Imagine this. You're doing everything right for your heart. Eating well, staying active, following your doctor's orders, and taking your daily medications as prescribed. Yet despite your best efforts, there's a hidden danger that could be quietly weakening your heart each day, and you may not even know it. As a heart surgeon who's helped over 8,000 seniors return to healthy, active lives, I've seen firsthand the surprising threats that can hide in plain sight right inside your own medicine cabinet. With over 25 years of experience in the operating room and clinic, I've witnessed the remarkable resilience of the human heart and the subtle ways it can be harmed when we least expect it. You see, many of the most common pills taken by seniors every single day, sometimes for years or even decades, can actually increase the risk of heart failure, irregular heartbeats, or even sudden cardiac events. Some of these medications are prescribed by your doctor. Others you may pick up over the counter thinking they're harmless. But for older adults, especially those with existing heart conditions or risk factors, the effects can be serious. Why should you listen now? Because as we age, our bodies handle medications differently. What was safe at 40 can become dangerous at 70. Kidneys slow down, blood vessels stiffen. The heart may already be under strain. The result? Pills that once protected us can start to backfire sometimes with subtle symptoms that are easy to ignore until it's too late. Today, I want to arm you with the knowledge you need to protect your heart, your independence, and your quality of life. I'll walk you through the 7 most common medications that can silently weaken senior hearts, counting down to the one I consider the most dangerous of all. If you or someone you love is over 60, this is a conversation you can't afford to miss. Let's dive in. Now, how exactly do common medications end up harming the heart, sometimes without a single warning sign until things get serious? Let's consider a typical story. One of my patients, Mrs. Evans, age 74, had always prided herself on keeping up with her health. She managed her blood pressure, took her arthritis pills, and even used over-the-counter cold medicine when needed. She felt fine until, out of the blue, she began experiencing shortness of breath and swelling in her legs. What she didn't know was that a simple painkiller she'd taken for years was slowly putting extra stress on her heart. Mrs. Evans is not alone. Across the country, millions of seniors are prescribed or buy medications that can raise blood pressure, cause fluid buildup, or throw off the heart's natural rhythm. The scary part? The symptoms are often easy to chalk up to just getting older. Fatigue, dizziness, mild swelling, an extra heartbeat here and there. It's easy to miss the connection between a pill you trust and the subtle changes happening in your body. Why does this happen? As we age, our organs work a little differently. Medications can stay in the body longer, and side effects, especially those affecting the heart, can become more pronounced. This isn't to scare you, but to help you see that even medications considered safe for years can quietly start to do harm if we're not paying attention. Now, before we go any further, I want to be absolutely clear about my purpose. This video is not about fear. It's about awareness, empowerment, and practical steps you can take to protect your heart. My job as a surgeon is to help you stay out of the operating room whenever possible. And that starts with understanding what goes into your body. Do not stop any medication on your own. Every pill has a purpose, and for many people, the benefits outweigh the risks. But if you recognize any of the warning signs I discussed today or see your medication listed in the countdown, make a note and have an honest conversation with your healthcare provider. There are almost always safer alternatives or simple adjustments that can make a world of difference. Stay with me because the #1 most dangerous pill for senior hearts will be revealed at the end. But every medication on this list deserves your attention, so let's start the countdown. And now, we begin with pill number 7. Pill number 7, ibuprofen. Brands Advil, Motrin. Common uses, pain relief, inflammation, fever. Why seniors use it: joint pain, arthritis, headaches, back pain, minor injuries. Heart-related danger. Ibuprofen belongs to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs. These medications can increase blood pressure, promote fluid retention, and, over time, put extra strain on the heart, especially in seniors. They may also raise the risk of heart attack or stroke with prolonged use. Who is most vulnerable? Adults over 60, especially those with high blood pressure, heart failure, kidney problems, or a history of cardiac events. Warning signs to watch: sudden swelling in the legs or ankles, unexpected weight gain, shortness of breath, chest discomfort, or increased blood pressure. Safer alternatives. Pro tips: for chronic pain, talk to your doctor about acetaminophen, Tylenol, topical pain relievers, or physical therapy. If you must use ibuprofen, use the lowest dose for the shortest time possible and never combine it with other NSAIDs. Surgeon's insight. I've seen more hospitalizations from just a little ibuprofen than most people realize, especially in folks who assumed it was harmless. And that brings us to pill number 6. Pill number 6, pseudoephedrine. Brands, Sudafed, Zephyrex D. Common uses, nasal congestion, sinus pressure, colds, allergies. Why seniors use it? Fast relief from stuffy nose or sinus discomfort, especially during allergy season or a cold. Heart-related danger. Pseudoephedrine is a decongestant that constricts blood vessels throughout the body. This can cause a spike in blood pressure and increase the risk of irregular heartbeats, arrhythmias, especially in older adults or those with heart disease. Who is most vulnerable? Seniors with hypertension, arrhythmia, coronary artery disease, or those on multiple medications for heart issues. Warning signs to watch: palpitations, racing heart, high blood pressure, dizziness, trouble sleeping, or chest pain after taking a decongestant. Safer alternatives. Pro tips: consider saline nasal sprays, humidifiers, or allergy medications like loratadine, Claritin, that don't contain decongestants. Always check the label. Many multi-symptom cold and allergy pills contain hidden pseudoephedrine. Surgeon's insight. Many ER visits for sudden heart symptoms start with a simple decongestant someone thought was safe. Let's keep moving. Next up, pill number 5. Pill number 5, amitriptyline. Brands, Elavil and DAP. Common uses, depression, nerve pain, insomnia, migraines. Why seniors use it? Chronic nerve pain, trouble sleeping, lingering depression, or persistent headaches. Heart-related danger. Amitriptyline is a tricyclic antidepressant. In older adults, it can disrupt the heart's electrical system, causing abnormal rhythms and even dangerous arrhythmias. It may also worsen blood pressure control and cause fluid retention. Who is most vulnerable? Seniors with heart disease, a history of arrhythmia, or those taking other medications that affect heart rhythm. Warning signs to watch: dizziness, fainting, irregular heartbeat, confusion, or sudden fatigue, especially if starting or increasing the dose. Safer alternatives. Pro tips: ask your provider about safer antidepressants like SSRIs, e.g. sertraline, or non-drug approaches for sleep and pain, such as cognitive behavioral therapy. Surgeon's insight. I always review older patients' medication lists for amitriptyline. It's a sneaky risk that's easy to overlook. Pill number 4, diltiazem. Brands, Cardizem Tiazac. Common uses: high blood pressure, angina, chest pain, atrial fibrillation, irregular heartbeat. Why seniors use it? Managing high blood pressure, easing chest discomfort, or controlling a rapid heartbeat, especially when other blood pressure medications haven't worked well. Heart-related danger. Diltiazem is a calcium channel blocker that slows the heart rate and lowers blood pressure. In seniors, it can sometimes slow the heart too much or lead to heart block, especially if combined with other medications that also affect the heart's electrical system. Who is most vulnerable? Older adults with existing conduction problems in the heart, those taking beta blockers, or people who already feel tired or lightheaded frequently. Warning signs to watch: slow pulse, feeling faint, sudden fatigue, shortness of breath, or unexplained dizziness, particularly after starting or changing the dose. Safer alternatives. Pro tips: if you notice these symptoms, don't stop the medication suddenly. Talk to your doctor about possible dose adjustments or alternative treatments, such as other classes of blood pressure medicine that are gentler on the heart rate. Surgeon's insight. Some heart-slowing meds can work a little too well, especially in people whose hearts are already running on low gear. And next in our countdown is pill number 3. Pill number 3, glipizide. Brands, Glucotrol. Common uses: type 2 diabetes helps lower blood sugar. Why seniors use it? Long-term diabetes management. Controlling blood sugar when diet, exercise, and other oral medications aren't enough. Heart-related danger. Glipizide belongs to a class of drugs called sulfonylureas. These can cause blood sugar to drop suddenly, hypoglycemia, which puts significant stress on the heart. Low blood sugar can trigger palpitations, sweating, confusion, and even dangerous arrhythmias or heart attacks in older adults. Who is most vulnerable? Seniors with fluctuating eating habits, kidney disease, or those taking multiple diabetes medications. Warning signs to watch: sudden shakiness, sweating, pounding heart, confusion, fainting, or feeling extremely weak after taking your diabetes pill. Safer alternatives. Pro tips. Ask your provider if newer diabetes medications, like DPP-4 inhibitors or SGLT2 inhibitors, might be safer for your heart and less likely to cause low blood sugar. Always keep a quick source of sugar handy and make sure friends and family know how to recognize signs of low blood sugar. Surgeon's insight. Low blood sugar episodes can be terrifying and more dangerous for the heart than most people realize, especially in older adults. Let's keep going. The risks keep adding up. Here's pill number 2. Pill number 2, diclofenac. Brands Voltaren, Cataflam, Zipsor. Common uses: pain relief, inflammation, arthritis, muscle injuries. Why seniors use it: chronic joint pain, osteoarthritis, back or muscle aches, sometimes used as a prescription cream or gel for sore knees or shoulders. Heart-related danger, like ibuprofen. Diclofenac is an NSAID, but studies show it carries an even higher risk of heart attack and stroke, especially with regular use. It can also worsen high blood pressure, promote fluid buildup, and stress the heart and kidneys. Who is most vulnerable? Seniors with a history of heart disease, high blood pressure, or kidney problems, or anyone using diclofenac long-term for chronic pain. Warning signs to watch: chest pain, sudden shortness of breath, swollen legs, rapid weight gain, or headaches that are new and severe. Safer alternatives. Pro tips. Topical diclofenac, gels or creams, may carry less risk than pills, but still isn't risk-free. For persistent pain, talk with your healthcare team about physical therapy, low-impact exercise, or other non-drug pain management strategies. Surgeon's insight. Diclofenac is often overlooked, but it's one of the riskiest painkillers for the heart, especially in older adults. Now let's take a quick pause and talk about something just as important as the information itself: how you can take action. If you've found any of these examples eye-opening or helpful so far, please take a moment to like this video, subscribe to our channel, and share it with a friend or loved one who might need this information. Heart health is a team effort, and the more people who know, the safer we all are. And because I want to empower you with real tools, I'm offering a free downloadable senior heart health checklist. It's packed with questions you can ask your doctor, tips to review your medications, and steps you can take today to protect your heart. You'll find the link in the description below. Print it out, take it to your next appointment, and use it to start a heart-healthy conversation with your provider. Now, let's get to what you've all been waiting for: the #1 most dangerous medication for senior hearts. Pill number 1, digoxin. Brands Lanoxin, Digitech. Common uses: heart failure, atrial fibrillation, irregular heartbeat, certain heart rhythm problems. Why seniors use it? For decades, digoxin has been a go-to medication for helping weak hearts pump stronger and for controlling irregular heartbeats. Many seniors have relied on it for years, often prescribed when other treatments didn't work as well. Heart-related danger. Here's the catch: digoxin has a very narrow therapeutic window. That means the difference between a helpful dose and a dangerous one is razor thin, especially as we age. The older you get, the more likely your kidneys slow down, which can lead to the drug building up in your body. Too much digoxin can slow the heart too much, cause it to beat irregularly, or even trigger life-threatening arrhythmias. To make matters worse, digoxin can interact with dozens of other medications, many of which are common in seniors. Diuretics, antibiotics, certain cholesterol medications, and even simple antacids can push digoxin levels too high. And because many seniors are taking multiple medications, this risk multiplies. Who is most vulnerable? Seniors with kidney problems, anyone on multiple medications, or those who've recently started or changed other pills. Women and people over 75 seem especially sensitive. Warning signs to watch: nausea, vomiting, loss of appetite, blurred or yellow-tinted vision, confusion, extreme fatigue, a very slow or irregular pulse, or even fainting. Sometimes these symptoms start off mild and gradually get worse. Don't ignore them. Safer alternatives. Pro tips. If you're on digoxin, never stop it suddenly. Instead, talk with your cardiologist about whether your dose is still right for you. Newer heart failure treatments and rhythm control strategies are available, and regular blood tests can help keep you in the safe zone. If you notice any new or worsening symptoms, seek medical help promptly. Surgeon's insight. I've seen lives saved and lost because of tiny changes in digoxin levels. This is the one pill I always double-check in every senior's chart. Remember, knowledge is power, but abrupt changes in medication can be dangerous, especially with digoxin. Always involve your healthcare team before making adjustments. Now let's take a moment to recap what we've learned today and focus on how you can protect your heart, starting now. Millions of older adults take these medications every day, often without realizing the silent risks they carry. Ibuprofen, pseudoephedrine, amitriptyline, diltiazem, glipizide, diclofenac, and at the top of the list, digoxin. Each one can quietly weaken the heart or throw its rhythm off course, especially as our bodies change with age and as medication lists get longer. But here's the good news. Awareness is the first step toward prevention. By learning which pills pose the greatest risk and knowing what warning signs to watch for, you're already ahead of the curve. The next step, schedule regular medication reviews with your doctor or pharmacist. Bring a list of every medication and supplement you take. And don't be afraid to ask, is this still the safest choice for me? Sometimes, safer alternatives or a simple dose change is all it takes to protect your heart and extend your independence. You're not alone in this. Your healthcare team is there to partner with you, answer your questions, and help you stay healthy and active for years to come. As we wrap up, I encourage you to share this video with your friends, family, or anyone you know who's over 60 and taking medications. Hit the subscribe button for more Heart Smart tips designed especially for seniors. And don't forget to download your free Senior Heart Health Checklist in the description below. You deserve to feel confident and empowered about every pill you take. Stay informed, stay proactive, and above all, stay heart strong.